The economic justice can be best won by free men through free enterprises. The government should be of laws rather than men. That Earth's great treasure lies in human personality, and and that service to humanity is best work of life. JCI mission to provide development opportunities that empower young people to create positive change. JCI vision is to be the leading global network of young active citizens.
Yeah, we all can sit. Good evening, JCs. Today we are having a session on menstrual hygiene by Dr. Vani Madam, and a privilege to Alekia, introduction of trainer.
Yes, Akka. Good evening to everyone gathered here. Myself, Alekia, JCI. A big thanks to each and everyone present here for joining our program by JCs. With great honor and pleasure, I would like to extend a warm welcome to our chief guest, Dr. Vani Iskopalli. She is MBBS MD from Andhra Medical College, Visakhapatnam. She is multi-medalist in UG and PG. Presently, she is a professor OBZ at KGH, Visakhapatnam. Her recognitions are, and she 42 paper publication, and she is a speaker in many national conferences, fellowship in advanced course in medical education, and ICMR fellowship in biomedical research. It's over to Vani ma'am.
Good evening, all.
Good evening, ma'am.
So first of all,
Good evening.
First of all, thanks to everyone for inviting me here.
Good evening, ma'am.
So I think, will you be comfortable if I talk in Telugu or English?
Yes, ma'am.
Yes, ma'am. Pretty sure, ma'am. Yes, ma'am.
Okay.
You are not audible, ma'am. Yeah.
The theme for today, so as you requested me, is I think regarding adolescent gynecological issues. And it is very, very relevant also in these days that even in my clinic, I very, very frequently see teenagers coming with lot of gynecological issues. So this could range from heavy menstrual bleeding or menstrual cramping pains or not getting periods at all. So there's a wide spectrum of presentation among the teenagers or adolescents frequently visiting our gynecologists. And it is very, very disheartening to see children in between 15 to 20 predominantly coming with the menstrual problems. And I think all of you know that we have a World Menstrual Hygiene Day. So any guess on which day is World Menstrual Hygiene Day? Anyone? Any idea? Any of the participants?
May 28th, ma'am.
May 28th. So it is it is almost commemorating with the fact that every woman will get period every 28 days and the flow lasts for 5 days. So that is why 28th of May, that is 28/5, is taken as the World Menstrual Hygiene Day. So let me basically tell you a few important things, especially in adolescents, which everyone has to know regarding what exactly is a normal menstrual pattern and what constitutes an abnormal pattern. As I mentioned, so generally in every woman, the period will have a frequency of happening every 28 to 30 days. and generally flow lasts between 3 to 5 days. And so per day, the standard sanitary pad use will be around 2 or 3 per day. So this is the normal pattern which is expected for any woman. So anything deviating this rule to the extent of 10% this way or that way, we say it is abnormal menstrual pattern which need to be seen by a gynecologist. So this is number one. The second important one is the menstrual cramping pains. So with this complaint, we get so many youngsters. At this age, it is very important that a lot of absenteeism also happens because of the menstrual pain. So many mothers come to us. So my daughter is having lot of menstrual cramping, and during menstruation, she would not be interested to go to the school or college. So this is very frequently upcoming complaints from the mothers that their daughters don't want to go to either school or college because of the heavy pain. For this problem, we don't expect any child or a teenager to get absent from either college or school just because of a regular physiological event, that is menstrual period, and small cramping that might happen. So there are lot of antispasmodic drugs which are available, like Meftal-Spas. So this is available over the counter, and to the extent of 2 tablets per day can be used even by purchasing over the counter. We don't expect any child to suffer from menstrual cramp and getting absent from the school, because today career is very, very important for each one of the girl. So generally we reassure and then tell them that these sort of medications are quite safe, can be used even over the counter. But if the pain is to such an extent that it is happening throughout the day, or which is having vomitings also, in such a case, that girl need to be evaluated further. So generally we do ultrasound scanning and all to see that anything is going wrong in the uterus. So this is the second most common complaint which we get in the teenagers. The next most important one is, I think all of you have heard about polycystic ovarian disease, frequently abbreviated as PCOD. Yes?
Continuously we are listening it.
See, it has become a very, very common problem. And surprisingly, these days, in this month itself, I have, so 2 families have consulted me that their son's marriage is fixed. And then afterwards, they have come to know that the girl is suffering from PCOD. And then they have cancelled the marriage. So these sort of things are happening. And now the most burning topic for any of the gynecologists is to counsel and convince a girl or their parents regarding PCOD. So PCOD, to expand, it is a polycystic ovarian disease. So here the main issue is, so what should happen every cycle? So that is, one egg will be growing to a certain extent and it will get released, and then either it will be fertilized or the menstrual period should happen. So this release is very, very important on the mid cycle. So that is on the 14th day. So in polycystic ovarian disease, what will happen? So none of the egg is reaching an appropriate size, and none of the egg is getting released on a monthly basis. So therefore, what will happen? All these will remain as small cysts or something like bubbles within the ovary, and this appearance on scan is called polycystic ovary. And so this will have a long-term effect. So definitely, this has a long-term effect on the fertility, and these girls in future would become diabetics or they would suffer from hypertension. So this is a common understanding, and everyone should understand this. It is not to frighten anyone, but PCOD might have long-term consequences. So therefore, it is very pertinent that it is recognized very early, and then we are supposed to treat it promptly. So generally, these girls are quite obese. So this, so many of the parents and wherever I talk, they will be asking, so in the earlier days, PCOD was non-existing. So why in recent times, the incidence is escalating up and up? So my answer would be lack of physical exercise. So now the teaching is happening in the four walls, and we see none of the intermediate students are permitted to do exercise. Their class starts from 7 a.m. So may extend even to 10 p.m. also. So in the four walls, so just sitting and listening, studying, that's all. So no sort of physical exercise for many of the teenage girls. So probably this is the most important reason why we are seeing polycystic ovarian disease very common in this age. So I think more than 30% of girls in between 18 to 22 are sufferers of PCOD. And the information is lot on the Google and the other sites. So wherein all the parents and the girls, they themselves read all this material and come to me with many of the doubts. So this is the third important issue of PCOD, wherein we see the girls are very, very fatty, and they have the menstrual irregularities and unwanted hair on the upper lips, chin, etc., and with lot of pimples also happening on the face. So this is the exact picture of how a PCOD would look like. But however, when it is diagnosed correctly at the right time, there are good number of medical treatment options available. So don't think it's a disease which cannot be cured. It is definitely curable. By adjusting the hormones, we would be able to resolve the menstrual pattern to normal, and but most important is having a weight reduction policy. So these girls need to concentrate on how to reduce the weight, either by exercises or by very strict diet control. So this is regarding the third important issue which would happen in that particular age. So with this brief introduction, I would like to participate more in the question answer session rather than me speaking alone in this forum. So I welcome any questions by the audience.
Yes, ma'am.
Any questions you can ask, ma'am?
So can I know which age group are the participants? Are they teenagers or mothers of teenagers?
I am a teenager, ma'am. Teenagers are there.
It's a mixture of both?
Yes,
Yes.
yes, ma'am. Both.
జాను అట్లేక మా జాను మాట్లాడాలి జాను అట్లేక జాను.
So, ma'am, I had a doubt.
Yeah, please.
Yeah, since my weight is not that much, but I'm pretty much overweight as compared to my BMI. But then it is not very much. Okay, so like my periods are a bit scanty. Before it used to bleed nicely, but these days, ma'am, they are a little bit scanty. So, is there a thing to worry?
So you mean you have scanty flow?
Yes, ma'am. Very less blood flow.
Very less. Okay.
I
So
don't
what
have
is your age?
cramps. I don't have any period cramps, nor
Yeah.
I like
So
any
can I know
other.
your age? Can I
Ma'am,
know
it's
your age?
21, 21.
20. So you're a student?
Yes, ma'am.
Yeah. So as I told earlier, all PCOD patients need not be obese, but obesity is seen in 80%. So what I mean by obesity is BMI anything more than 25, we say it is obese. But however, even if you don't you are not in that particular range, if you are having scanty periods or irregular periods, so probably you would be fitting in this group of PCOD. And even then, even if you are not obese also, regular physical activity and prompt balanced diet. So both these are very, very crucial things to maintain the hormonal balance in the body. So that there are the two important hormones in a female body, which are likely to regulate all the menstrual pattern, rhythm, flow, everything. These are estrogen and progesterone, and these need to have a good balance within the female so that everything is set right. So if any bleeding is scanty, that itself means that there's some problem in the balance between the estrogen and progesterone, and this definitely need to be corrected after prompt investigations. So generally we do thyroid profile and another hormone called prolactin. So these are the two important tests we do apart from an ultrasound examination to see whether really the ovary is having the polycystic pattern or not, and accordingly we go about with the treatment.
Thank you so much, ma'am. Thank you so much.
And the other important complaint, so generally we see in the age group of the adolescents is excessive vaginal discharge. So this complaint is quite common, and all these unmarried teenagers, so some sort of excessive vaginal discharge is expected at the time of ovulation. Ovulation will correspond to around 14th or 15th day of the menstrual cycle, and at that point of time, some excessive vaginal discharge is normal. And also just before the onset of menstruation also, some excessive discharge is expected. If we could convince a girl that at this point of time, for every woman, it is the excessive flow is expected, so then this sort of reassurance is simply sufficient for all these issues. But supposing if it is having any foul smell or some blood tinge, or if it is with some excessive itching at the genital area, so that is a matter of concern, and that is definitely because of some infection. Generally the infections are fungal infections, and these fungal infections are related to hygiene. So what we generally advise for these is for these girls is so maintaining good hygienic practices during menstrual period is very, very important. So not only for the point that if the hygiene is not maintained, fungal infections are most common. And these fungal infections may be so bothersome that it will cause itching of the private parts. And these girls will be behind because they don't want to mix up with a great, what to say, big gathering or any functions because of this problem. So the advice for these would be using only sterile sanitary pad. That is number one. And sanitary pad need to be changed once it is more than 50% stain. Number two. The third one is cloth or any other material should not be used. Everything should be disposable and it should be sterile sanitary pad. The other one and the most important is at the time of menstrual period, washing the private parts at each time the sanitary pad is changed is also very important. And keeping the area very dry will simply be the most preventive measure for any fungal infection. Whenever there is wetness at the private part, there is always a scope for catching fungal infection. So therefore, keeping the private parts dry. So that is another important precautionary measure. So this is one very, very important thing. And secondly, if any infection will happen because of poor hygienic practices, so what will happen? This infection at that point of time, it could be simple one, but repeated infections every cycle. So this will lead to what is called as chronic infection. So this chronic infection might have an effect on the future fertility also. So this infection might ascend into the fallopian tubes, ovaries and all, and the motility of these important structures will be hampered by the infection, and therefore there could be fertility issues also arising out of the chronic infection. So every girl should be therefore advised that whatever you practice today would be of lot of benefit in the future. So therefore, promoting all the good hygienic practices during menstruation should be the part of the teaching for the girl students right from the school itself. So generally we go to schools. So I went to many of the schools to simply to promote hygienic practices in the school going and the college going children. So hope this is understood regarding the important things what I have said.
Yes, ma'am. Yes, ma'am.
What exactly
Ma'am.
constitutes a normal menstrual period? Second thing, I told you something about menstrual cramping. And the third one issue regarding polycystic ovarian disease, commonly called PCOD. The fourth thing regarding menstrual hygiene and the common white discharge. And so what is important regarding fungal infections and why menstrual hygiene is important. Otherwise, what would happen in the future for the girl child?
Excuse me, ma'am.
Yeah, tell me.
Ma'am, will you suggest any like cleanser for intimate area, like which we are available in the markets? Can we use, or do you suggest any other like which is very important for us, which is good for us?
Whatever is available in the market are quite sterile and they can be safely used. But the main thing is reusable cloth and all should be strongly discouraged.
Means a
And
sanitary
at this point of time, the poor girls, especially studying in the government schools and all, so might not be aware of this, or might not be economically feasible for them to purchase the sanitary pads. So we, as Obstetric and Gynecological Society of Visakhapatnam, last year on 28th of May, we went to number of schools, and then we have distributed sanitary pads for the tribal area students and also the semi-urban area of Visakhapatnam.
That's nice, ma'am. 1 minute, ma'am. There are some recognitions. Chair recognizes the presence of JCA Senator Hakalya, IPP and Zone Coordinator, Growth and Development. Hakalya, you're there, right?
Thank you, President. Thank you.
Chair recognizes the presence of ZBP Region D, Rupa Saripuri.
Thank you, President, and very nice program.
Thank you so much. Ma'am, you can continue, ma'am. Any question and answers? So this is any questions for ma'am, you can please ask. Any more questions?
Ma'am, there was one more question. So these days, these tampons and menstrual cups are available in the market. So can we use
They are
that?
available. Menstrual cups are available, and if one is convenient to, if it is comfort to use for a particular girl, they can use them, no problem.
Thank
But
you so much,
personally,
ma'am.
I feel that it is quite painful or cumbersome to use it. But however, I heard from many of the youngsters that it is very, very convenient for them to use menstrual cups. So if it is convenient for them, they can use. No problem, no issue.
Ma'am, this is Shravani. As she asked, can we use this menstrual cups? No, in some of the cervical cancers, causes for cervical cancer and all, there is a Dutching of vagina is one of the cause for, no?
No, it is not. It is not linked with any cancers and all. And because you have raised the topic of cancer cervix, it is the commonest cancer in the female in our country at least. So at this point of time, I would like to educate you that we have a vaccine against cancer cervix. Cancer cervix, the causative organism, human papilloma virus, and we have now good vaccines to cover the HPV infection. And so these vaccine ideally should be started at the 12th year of a girl. And if anyone is taking at that point of time between 12th to 15th year, 2 doses are sufficient. And if anyone is starting beyond 15th year, 3 doses are required in a span of 6 months. And this works wonderfully. And we can assure that almost 99%, the woman who has fully vaccinated against the HPV would not get the cancer of the cervix in the future. So I think for all mothers, if at all you want to gift your girl child anything, please give them HPV vaccination. It is not available with the government. Each injection would be costing around 3,000 rupees. However, the amount you are spending is really, really worth.
Thank you, ma'am.
Okay.
Yes,
So if
ma'am.
there are no further questions, can I leave?
No, ma'am, I have other doubt. Ma'am, do you
Yes.
have in a particular time to take that vaccine, like after period or before periods like that? Or anytime we
Which
can
one,
take?
vaccine?
Yes, ma'am, vaccine, HPV vaccine, you told me.
Vaccine can be taken at any time, even during menstruation. At any point of time, it can be taken. So general
Okay.
schedule is, if you take on today, the next injection would be after 2 months, and the third injection would be after 6 months.
Okay, ma'am. So we have to take
3
like
doses.
after 30, we have to take like 3 doses, right? Now, if I
After
want to take,
15, yeah, after 15,
yes,
3
after
doses.
15. Yes, yes, ma'am. Sure,
Yes,
ma'am. Thank
yes.
you, ma'am.
Yeah, ma'am, one or two members would like to give you feedback. Guys,
Okay.
can you
Yes.
just give a feedback to ma'am? How was the session and all?
Ma'am, I have one doubt. Ma'am, can we give this
Yes.
vaccine for 50 plus age group, a woman?
No,
Like
no,
my mom and all?
see, yeah, it is a costly vaccine. So if you give the injection to a teenager, the benefit is maximum.
Okay.
If it is beyond 45 years, the benefit is very, very minimal. So generally, we do not encourage after 45 years. However, if it is taken also, there is no harm also.
Okay, ma'am. Thank you, ma'am.
Yes.
Any two members can give feedback.
Yeah, so today's session, I'm Smriti ma'am. So I feel that today's session was really informative. How you told us about the PCOD disease and the hormonal balances between our body, like progesterone, estrogen, and all. And it really helped, and you clarified a lot of our doubts. So we are really grateful to have you, ma'am. Thank you so much.
Anybody else? I would like to give a feedback, ma'am. In fact,
Yes.
the members don't know that you are my senior in school. Nobody knows. It's just a matter of just a day. I think this morning I just messaged ma'am that today we want a session, and it was really a great, in fact, it's a gesture from your side that you just took up the session within a few hours. I think, and thank you so much. It was really an informative session, ma'am. Uh, and vote of thanks by Shravani.
Ma'am, thank you so much for your time and efforts for educating us regarding this menstrual hygiene and other much more things. And it was really informative regarding that menstrual cup. Other point is like cervical cancer vaccination are very useful points. And thank you so much for it. We hope to provide this kind of training to teenagers in the colleges and hospital staff and patients, those who are suffering with this gynec issues. Thank you, ma'am. Thank you so much.
Okay. Thank you, one and all, for inviting
Ma'am,
me
thank
here.
you so much.
Yeah.
Yeah. Yes, ma'am. I'm just going to adjourn the meeting. I, JFM Mamila, in the capacity of President of JCA Vizag Excellence Apex, adjourn the meeting at 9:45 over Zoom platform. Thank you, guys. Okay, ma'am. Thank you so much. Thank you for joining.